Hello, everybody. I'm so excited today to welcome Stephanie Curran from Elements of Health Center. Today, she is talking to us about acupuncture and acupressure leading up to delivery and during the labor process to help with pain. Just a little reminder before we get into it that She Found Health is meant for general medical information only. The content of this blog and video and podcast series is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have a question or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and our guests are not representative of any institution with which we are affiliated. So this session is a video in our prenatal class, masterclass in labor and delivery. So we're releasing the podcast to you guys, but if you want to watch the video, you are welcome to check out our course. It's at our website, www.shefoundhealth.ca, and we call it Masterclass for Labor and Delivery and Insider View. So let's get to it. Hello, everyone, and welcome to She Found Health. We are so excited today because Stephanie Curran from Elements of Health is here to talk to us about acupressure leading up to labor and in labor. She's also going to talk about acupuncture and what roles those have in preparing for labor. Stephanie is a practitioner of traditional Chinese medicine and acupuncture with a special interest in women's health, fertility, and reproductive health. So the first time I met Stephanie was actually as a client. I was 41 and 2 weeks gestation with my first born baby, and he was not coming. So I went to go see her to get some acupuncture in the hopes that that would bring labor on. Well, 2 hours later, my water broke. The labor didn't quite happen, but the water broke. So I'd say it was a success. Anyway, so Stephanie, why don't you tell us a little bit about yourself and your practice, and then we'll get into it.
Thank you so much for having me today. I'm excited to be part of this session and to share some of the information about acupressure and how it can be of support during labor. So I've been practicing, and I was just thinking about this just last night, that I've been practicing for 20 years now. I graduated in 2000, and most of my practice has been related with obstetrics and fertility. And early on in my practice, I attended births as well. I did a doula training and attended 50 some odd births, and then have also had the pleasure of birthing my own child. One of the most important jobs that I have is being a mom. My daughter Shay turns 8 coming up in a couple weeks. And yeah, it's one of the things I love most about practicing is helping support labor and becoming pregnant and being pregnant and postpartum. It's such a pleasure and such a joy.
It is a pretty incredible time of a woman's life. And so part of what we're going to talk about today is how can we prepare for labor, because it is a challenging time, and often one has to be very patient when one is waiting for labor to come, because those babies have their own agenda. And so that's part of what your role in a family's journey is. Tell us a little bit more about those pieces of it.
Yeah, so depending on when I meet people, sometimes I've been working with them for a while as they've tried to conceive. And then through their pregnancy, we often are seeing people in a once a month kind of checkup, wellness checkup through their pregnancy. And then it's around 37 weeks that we'll start doing weekly sessions to prepare for labor with acupuncture, and then giving people some acupressure points that they can work with and use at home, which will be the focus of what we're talking about today. And then I know you and I are having another conversation about this, but always for me, part of what I'm including in my sessions and conversations with people is also how to bring mindfulness, how to bring this lens into the experience of approaching labor and postpartum as well. So yeah, that's a little bit about, but then also, maybe I meet like you did, like I met you on just, you're right about to deliver and your post dates, and we're trying to give things a little wiggle and a niggle, as I like to say, to welcome the little one along. So yeah, I meet people at different stages of the process. Yeah.
Great. So why don't you start off? So we wait till 37 weeks until starting to work towards getting into labor. And that's because we want babies to be term. So we define that as 37 weeks from the first day of your last menstrual period. And so what would that look like in your practice?
Yeah, with people coming in, the focus at 37 weeks is really just to encourage the cervix to begin softening and to encourage the little one down in the pelvis, because that starts, of course, to apply pressure to the cervix and for some effacement and thinning of the cervix and some dilation and opening to begin. And so, yeah, we wait until 37 weeks when they're term. But that said, if there is the recommendation from the doctor or the obstetrician or the midwife, that their blood pressure is high, for example, then, and we know that there might be an induction date at 38 weeks, then maybe we start just a little bit earlier, but that's guided by the physician or midwife.
Right.
But
And so
typically it's 37 weeks. Yeah.
And so most of the work that you're doing at that point is with acupuncture, or are there some
Yes.
acupressure pieces at that point as well?
Yeah, if you're seeing us in the clinic, we would do acupuncture and send you home with some acupressure as well. So the points that we would be guiding people to for acupressure, the first one that we can talk about, and we'll have some images coming up on slides to show you as well, but I'll just sort of try to show you on my own body, is a spot called Gall Bladder 21. So it's kind of at this point in the top of the shoulder here, the trapezius, and it's about halfway between where your spine would be in your neck and the top of your shoulder here. So if you draw like an imaginary line and you're just halfway there, not acupressure points are not right at the apex of things. It would tend to be in a little bit behind, like more the depression that you would naturally feel there. And we apply pressure to both of our both points at the same time. And ideally for the person applying pressure, this would be a little bit awkward to do yourself. I mean, I can get to both of these. Even better than doing it like this is if I give myself a hug, which is kind of sweet. And then I can apply the pressure a little bit easier. And what we want to do for the applying of this pressure is that it's not so much a massage or a kneading, it's a pressure for about 4 to 5 minutes. And if you have an exercise ball to sit on, that's really nice because it kind of sinks, like it allows you to kind of really go with the grounding that's happening of when someone goes to push those points down. And I distinctly remember, which is always the interesting thing when you get to experience it for your own body after you've coached so many others in it, right? I distinctly remember the feeling when this was being done on me, that I felt it in my pelvic floor.
Mm-hmm.
I could feel that there was a downward energy to it, and that's the intention with this one, is to encourage the one down in the pelvis. And so something else that's a tip for whoever is helping to apply the pressure is that if you're right on the tip of a finger, it'll feel pokey. It won't feel that great, and the nail will likely, whoever your support person is going to be, they want to have a well-trimmed nails. Otherwise, it doesn't feel good. If you can use more of the surface area of your thumb, that's always going to feel a whole bunch better. So so if the person who's supporting is standing and the person who is receiving is sitting, then it's easy for that person. If I just kind of hover and stand up a bit, you can tuck your elbows in like this and then just lean forward with your body weight, as opposed to being awkward like this. That's not going to feel good for very long. So creating some ease to the pressure that way.
Awesome. So that's a great first one to start with. So you'd start with that
Yeah.
around 37 weeks. And how often would you do that?
I'm encouraging people to do it daily. And we combine this with a couple other points as well. But yeah, doing it daily, particularly if you're first time pregnancy, there tends to be a pattern, not always, but there tends to be a pattern of going post dates. And so as much as we can do to support with the other wellness things that you're doing, like keeping active and mobile, and maybe some lunges and squats, and these kind of pelvic opening kind of things are supportive as well of the little one making their way, starting to niggle down. Yeah.
Great. So you mentioned there's some other points that you might use. What would those be? Or are you able to talk about those a little bit?
Yeah, for sure. So this one is gallbladder 21. We can call it a shoulder point. And then the other one is called bladder 31, 32, sort of in that area, which is in the sacrum. So there'll be a diagram again shown of where that is right in the lower back, sort of in the buttocks area. And there's two little foramen, which are like little holes that are in the sacrum. The sacrum's like this little triangle shape right here, and your tailbone's right at the end of it, your coccyx. And I'll just draw a little picture here, be all fancy here, with what I'm going to draw here. So if this is the buttocks crease here like this, can you see this?
Yep.
Yeah. So if this is the buttocks crease here, if you take the length of a woman's finger from the point to where it attaches to the hand, and you kind of make like an equilateral triangle with angling it like this, you're going to end up with points that are kind of about like this right here. That's how it's going to look from the buttocks crease. It's going to be like an equilateral triangle like this. And this is where you want to be applying the pressure. For some women, there's dimples there. For some, so that's really easy. It's like, oh, great, right there, it's obvious, right? And for some people, it's easy to feel the holes and sort of like a depression there. And for some people, you don't really feel it much at all. And everyone's anatomy is a bit different. And so the way that I find it with ease is, again, using this flat surface of the thumb. When you go to apply the pressure, if you don't kind of like jam in there, but you just kind of apply on the skin and then just press slightly, and you kind of move around, like I'm exaggerating, I wouldn't be moving quite this much, but if you just kind of move around a little bit, there's like this natural depression, really, like there's a hole that your thumbs kind of sink into. And then if the person is sitting in front and to receive and leaning forward like this, then that kind of exposes their back and allows it to protrude out a bit more. And then the person who is going to apply the pressure can come behind again, nice with the elbows in here. If you can then lean into it to save your hand strength. If the person's in the right spot, it'll feel, women like that in pregnancy. It feels good to have the pressure applied there. So it will feel good. If it feels a bit sharp, or kind of like not that comfortable, it means they're not quite on it. So just shift a little bit more to the left or a little bit more to the right. But if you're in the right spot, it should feel good. And again, that one would be for 4 to 5 minutes in that area. So this one is good to do in prepping for labor to just encourage the cervix, again, to be ripening and softening. And then it's also one that we use in labor, and I'll talk about that coming up too.
It sure is. And we also use those points if we're going to do little saline injections for pain management in labor too. For the same general area. I'm assuming it's probably the same area.
It's pretty much the same area.
Yeah. And that's a natural one that women really like in labor as well. So we'll chat about that a little bit later too.
Yeah.
Great.
Yeah. And then the last point is not so much a point as it is an area. And so it's more of a massaging. So these first two, we're applying pressure on the shoulder for 5 minutes. We're applying pressure in the sacrum on bladder 32. And then this other one is just generally called the buttock point. And so where it's located, if we come back to my lovely diagram here, where it's located is from this spot to, if we imagine the rest of the bum is sort of coming out here, where your hip bone is, you're kind of massaging between here out to here and from here out to here. And the nice way to do this, it feels good if you have some kind of oil or even hand cream or something that's going to create some slip and some glide as opposed to right on the skin. And for me, it felt good. And I like doing it this way, where you're applying pressure with the heel of your hand, plus your thumbs could probably use a break at this point. So then it's just this massaging and kneading, this idea again of the glutes really sort of opening up and the pelvis opening is quite helpful.
And so for the massaging, it's taking it from that original point, that bladder
Yes.
32, 33 point.
Yes.
And then going out to the bony hip bones that you feel at the edge of of your hip.
That general area. It doesn't have to come all the way out to that bony bit, but sort of that opening across that whole area.
And you're going from inside out.
Inside out, yeah. Because going in would be more closing, so we want it more outward and expanding.
Yeah, perfect.
Yeah.
So we've talked a little bit about preparing for labor. So, and we kind of alluded to a couple of things that we do in labor as well. But why don't, if you don't mind, Stephanie, talking about how can we help manage the pain in labor and help kind of progression in labor, either yourself or your support person doing that?
Yeah. So one of the things that I recommend to people is to start the acupressure on the one hand earlier on, because with each contraction, if you've built this momentum, then it helps with the endorphin response for managing the pain. And because it's not like right in the middle of it all and you're in transition, that you're going to apply pressure on a point, anything magical is going to happen. It's not so much like that. Yeah. Mm-hmm. So it needs to be sort of a progression and a build up along the way. That said, don't start too soon, because you don't know how long your labor is going to go, and your poor support person, you might be like needing that, and their hands are kind of done. And so my guide is always when you're no longer talking through your contractions, might be a good time to start. Mm-hmm. Because if I was right now having a contraction and, oh yeah, here it comes, and oh yeah, it's getting a little stronger, and yeah, I really think that, and we're timing them and we're talking, don't save your fingers. That's not the time. It's more when we're in the middle of the conversation, I have to, it's more like that's when,
yeah.
Right? Yeah.
And all of that work that your partner has been helping you with for the 3 weeks leading up will have actually helped him or her get their hand muscle going too, right?
Totally.
So they'll be nice and strong, but
the other thing it's going to do is it's going to have them feel really confident about the points, because the very last thing a woman in labor wants is you fiddling around with her body and asking her if this is right and a little bit more pressure, or how does it feel when they're just going to shush you if you do that. So so don't be asking for feedback in the midst of a contraction. Just do the thing you've been practicing for some time leading up, so you know where the points are. And then at the end of the contraction, you could ask, how was that? Does it a little bit less or a little bit more? Be sure and clear that if it's not working for the woman, she will let you know. And it may not be with words, it might just be a swat, And so I always give this encouragement to support people. If you're being swatted, it's not that the acupressure isn't working and don't do it again with the next contraction. It's just, it was either too much, or you check in the pause.
Yes.
Yeah.
During a contraction is not an easy time to give feedback in a positive way.
No.
But after, get some feedback and readjust for the next contraction.
And the other thing that is really important too is this is going to be a time where just get to the pressure and apply it. Moving, any kind of movement or stroking during tends not to be received so well. In the period of the pause, yes, this would feel good, but not in the midst of contraction. And even as you're approaching the woman, if you're going to try to sit down on the bed, like that might even be like don't move the bed. So depending on which stage of labor you're in. So just for support people to be aware of that it's a firm applied pressure, not any massaging.
Yeah, for sure.
In labor. Yeah.
And is there, as one progresses through labor, have you found certain points to be more useful, less, like does that change throughout the labor, or are all three kind of actions as useful, or are we just talking the two actions, the two pressure points?
Yeah, I would say that, really any of them are going to have the effect of building up this endorphin response, right? And having other sensory input happening while lots of other physical sensation is happening, right? So it kind of is twofold that way. So really you could choose any of the points at any time when you're in the midst of labor, right? And it would be fine. The one that I find most women receptive to and feels good, and I really wanted for my own body, was this one that's in the back. Here, this bladder 32, a point in the sacrum area. And for me, as it was getting started and clear that labor was establishing and I was no longer talking, for me, it was happening in the kitchen, and it was approaching dinner time, and I was insistent with my partner that they cook some dinner for themselves, because I had this understanding it could go on for a bit, and I wanted to make sure he was fed. So we have this funny thing in our house now. For every dinner for Shay's birthday, Daddy cooks pasta because that's what was happening in the midst of it all. So, and he was just laughing because he could hardly get anything done, and I'd be calling for him to apply the pressure, because it made that much of a difference to my tolerance of the wave of it coming through my body. So that if there was a contraction where he wasn't applying the pressure, I'd notice the difference between when he wasn't and when he did. And so he was doing his best to chop it and be there. Yeah.
And I think part of that is just the distraction. There's another point of sensation other than the labor. And so that's also kind of, we're going to do another chat around mindfulness, but that would be another place where mindfulness or hypnobirthing, some people do, or just really defined breathing techniques. It just takes your focus away from the contraction and puts it onto something else, which in and of itself is an excellent pain management skill.
Absolutely.
And so
Absolutely.
do you mind having a quick chat about mindfulness in kind of labor and how you've seen it used before? And we'll certainly delve into that a little bit more.
Yeah. And I think what you've just described of having the attention somewhere else, but also sort of a widening of the lens of what else is here right now, right? What else is here in the experience, so that there's an allowing of the wave to come through, as opposed to a bracing against and a resisting against, right? So because if we're contracting around the contraction, the job of the contraction is actually an expansion, right? As that contraction is happening and the uterus is contracting, what's happening with the cervix with that squeeze is that it's opening, right? As the uterus is squeezing down and applying pressure for the baby to be making its way. So even just having that difference in language, and I know this in hypnobirthing, they do this as well, where intense sensations, rather than just thinking about a contraction, reframing it in our minds of like, how can it be an expansion? How can it be an opening? How do we allow what's here as opposed to brace and resist against?
Yeah, and I think that's great. And I think that's a really important point, is understanding what is going on within your body during this time, and using that understanding to really help things along. Because we do, I mean, labor, no offense, everybody, labor sucks. It hurts.
Mm-hmm.
It's amazing because what your body is doing and what you get out of it, incredible. But it hurts a lot. And so if we go into labor with an expectation that, one, it's for most people going to hurt a lot, and two, what is actually happening within our body, and understanding that physiology a little bit more and the actual kind of patterns of what is going on, we can use that for a beneficial thing and to help us reframe things, as opposed to it hurting and us using that fear of the next contraction and clamping down. Because when we do find women do this, unfortunately, when labor hurts and they just contract everything, and so then baby can't come down into the pelvis. And so I think reframing it in your brain, and that's part of mindfulness, right? It's my understanding, it's kind of separating yourself from what's actually going on and getting a bigger picture, is it can be incredibly useful. So
and allowing it to be there, and allowing and sort of trusting that it's a normal unfolding, right? It's not normally pain is something that we're afraid of and it's fearful. This is good pain, right? It's weird to think about it that way, but just sort of the not contracting around the contraction because we're afraid of it, right? And we'll get more into it in when we talk about mindfulness, but there's actually a lot of pause in labor, and where are we in that, right? We're thinking about the last contraction and how hard it was, and oh no, the next one's coming, and we miss out on this sweet spot that's in the middle.
For sure. So let's do a recap. First of all, starting acupressure / acupuncture around 37-ish weeks, give or take, based on your own personal pregnancy. But if you have a normal, healthy pregnancy, then 37 weeks. There's two specific points: the Gall Bladder 21, which is the shoulder, and the bladder 32, which is kind of what we would call the sacral dimples, but the kind of lower back area. And then that massage point, so from the inner back to the lower outer back, using the heels of your hands. So working on that kind of daily for 4 to 5 minutes. And then using those points as it feels right for the laboring person during labor as pain management, and starting not too early, but once you kind of start having to kind of breathe through your contractions and not being able to talk, so to spare your support person's fingers and strength, but starting those earlier in the process, not when you're in kind of acute extreme pain.
And I will say about that bladder 32 point in the sacrum there, that once labor has progressed along and you're entering into transition, it likely won't feel good anymore.
No, nothing feels good in transition.
No, it's true, but someone applying pressure right there is terrible. My husband got swatted when he was trying to do that on me at a certain point, and I've experienced that in the births that I've attended along the way. Is if that is not feeling good anymore, it's likely the little one is moved quite far down in the pelvis, and that pressure there isn't good anymore. So then you might be coming up to one of these points, right? Because this is also a helpful point up here. It has such a strong downward effect, that when a woman is pushing, for example, that might be a great place to push on. Or, this is a funny thing to say, but the toilet is a really awesome place to hang
Well,
out.
the toilet is great. I pushed
Toilet is,
for like an hour.
it's
The poor
fantastic.
nurse. The nurse was having to I lie on the ground just to listen to my baby, though.
I know.
It felt bad for Di, but
It's all kinds of awkward to be part of the process, or apply any kind of pressure or anything. But you can for sure, on wherever you are in the bathroom of a toilet, at least get to one of those shoulder points. And twofold with this. Number one, it's applying the downward thing while they're on the toilet. The pelvis is really open. But there's a tendency when you're sitting on the toilet like that, it's usually you're further along in labor if you're doing that. Is you want to brace, you want your heels pushed down, and you kind of like your body does this up against the toilet. So this helps sort of like that reminder and that cueing of like grounding and actually allowing yourself to sink into it, which is counterintuitive, but helpful.
Great tip though. Great tip.
Yeah.
And then the other thing is using mindfulness to change your perspective on the pain of labor, to think of it more in a positive sense, to allow yourself to use that to benefit. And the other thing I just want to mention is this technique may work for some women throughout. If you get to transition using this, amazing. But it is also a tool in a toolbox, and there's other tools that some women, this may work for a certain amount of time, but not the whole time, and that is okay. There's no winners or losers in labor. If you make it and have a lovely vaginal delivery using this, just amazing. But if you need other tools as well, then that is totally fine too. And I really think it's important for women and their partners to recognize that just because if you do need something else for pain, it's not because you weren't doing this right. This got you to a certain point, and then something else may be needed. But some women, this will be an excellent pain management skill, and they may make it the entire way through this, and that would be wonderful too. So I just think it's really important for us to all recognize that we're all different, and our labors are all different, and our babies are all different, and our experiences are all different. So using what tools you have in your toolkit to make it through is what's the big piece of this chat.
Absolutely. I 100% agree. And depending on what other supports or, needs are appropriate, as you're moving through labor, it doesn't mean that the acupressure has to stop, for example. Like if you've got an epidural, right, and you're pushing, you can totally still use this point to help support the pushing, right?
100%.
So it doesn't necessarily mean to be just one or the other. It's like, how do we support the well-being and the whole experience of it? Because, for example, this point is also a really good one if a woman is feeling really overwhelmed by the process. It has a grounding effect to it. There's also a spot on the bottom of the foot. It'll come in the handouts that we attach to this presentation. If this is your foot, between the second and third toes, right in sort of this bit below where your ball of your feet are, is a spot called kidney 1. And it's really helpful to apply pressure on that if there's a lot of fear happening. It has, again, this very deeply grounding aspect to it. So different ways to support along the way, no matter what's happening.
Which is fabulous, because we all need a little bit more support.
Yeah.
So I think let's end this section here. Again, thank you so much. This was incredible. And I think it's so wonderful, not only for the laboring woman, but for their support person to really get involved and really help support them through that time. Because I know a lot of people don't know how to support and don't know what to do. So this is a wonderful way that they can be involved and support through those last few weeks of pregnancy and throughout the labor period. So it's incredible. So thank you so much, Stephanie. And tell us where we can find you.
The Elements of Health Center, we're in the Hillside, Shelburne area is where our clinic is located. And our website address is www.elementscenter.ca.
And we will put a handout in the show notes. So for those of you who are listening and not watching, you can get a sense of where those points are as well. Or you can take your little cheat sheet with you to labor, although you should have been practicing it before you start. So we'll end on that note. Have a wonderful day, everybody.